Hello guys, welcome back to my channel Pharmaco Essentials. So in this video mainly I'm going to cover the topic of antibiotic, particularly aminoglycosides we are going to study here. So first, mainly speaking, aminoglycosides are bactericidal in nature. You know what is bactericidal and bacteristatic? Yes, bacteristatic are those kind of antibiotics which will inhibit the growth of microorganism, but bactericidal are such kind of antibiotics which will kill the microorganisms instead of inhibiting its growth. So this aminoglycosides are mainly isolated from a bacteria which belongs to the order Actinomycetales. If I speak about specific genus, the one which belongs to the Streptomyces is Kanamycin, Neomycin, Tobramycin and Streptomycin. And the one which belongs to the genus Micromonospora is Gentamicin. So the spectrum of activity, like it mainly acts on both gram-positive and gram-negative bacteria, but maximum effect is seen in gram-negative bacteria, especially towards the Streptococcus aureus. There are some of the major side effects that we have to remember and monitor the patient accordingly. The first side effect is ototoxicity, nephrotoxicity, neuromuscular block, and allergy. Now let us see how does it exerts its effect or its mechanism of action. First of all, it goes and binds to the 50S subunit of the ribosome. We know that ribosome has 30S and 50S subunit. In that the 50S site it will go and bind, which will cause misreading of colons along the mRNA. This will further cause error in proofreading process of translocation. Now after that what happens? There will be improper protein translation and hence bacterial cell wall will be damaged and bactericidal activity can be seen. So let us now discuss each of the antibiotics isolation and spectrum of activity separately. The first one is streptomycin. It was actually first discovered aminoglycosides. It was discovered in around 1944 and it is mainly isolated from Streptomycin graeceus. So it is mainly used for the treatment of TB along with the combination of other anti-TB drugs. Because it is used in combination because it will develop resistant very rapidly. So it is used in combination. Next is neomycin. Neomycin is actually very highly toxic and hence systemically it is not given to the patient. Moving on to the kanamycin. Kanamycin is less toxic compared to the neomycin and it can be given systemically to the patient. Next is gentamicin. Gentamicin is mainly isolated from Micromonospora purpurae. In around 1963 it was isolated and it's active against life-threatening microorganism, that is Pseudomonas aeruginosa. Moving on to tobramycin and amikacin, that is also same. It shows the spectrum of activity towards the Pseudomonas aeruginosa, major spectrum of activity. And this amikacin is mainly synthetic derivative of the kanamycin. Last but not the least, hence these aminoglycosides have major side effects. So the patient need to be monitored in every step of the therapy. Because I have seen a case where due to aminoglycosides, a patient had developed a nephrotoxicity due to lack of monitoring of the patient. Thanks for watching the video. Please do like, share the video and subscribe the channel.